Hi, I am Christine Tran, a master's student of the School of Biological and Health System Engineering at ASU. This is a brief summary of my formal research sponsored by Mayo Clinic. Here is a little background about the issue that my research tried to support. Surgical site infections, SSIs, including prosthetic joint infection, PJIs, continue to create the significant problem associated with prolonged patient mobility and increased mortality. These complications after surgery can place a significant physiologic burden on the patients and a substantially financial burden on the healthcare system. Therefore, it is critical to continue to look for the improved infection prevention and management strategies in the surgical procedure as a whole and in orthopedic surgery specifically. Antiseptics, antibacterial solutions have shown to be effective in eliminating most of the bacteria in certain surgical settings. Although the effectiveness of multiple antiseptic solutions has been demonstrated with the irrigation time of 2 minutes or longer, their efficacy at shorter time interval has not been well defined. Besides, the effectiveness of the antiseptic solution on a QT bacterial magnus, an organism that has been become more and more problematic in orthopedic world lately, has not been studied. So the purpose of this study is to determine the optimal exposure time and clinically relevant concentration of the common use antiseptic solution against a high resistant human skin bacteria in order to provide an improved infection prevention strategy. The three bacteria tested in this study include Staphylococcus aureus, Staphylococcus epidermidis, and the C. acnes. The five commonly used antibacterial tested in this study include the dilute chlorhexidine, dilute povidone iodine, polyhexanide pyridine, Bactocin, and sodium hypochlorite. The bacteria were cultured until they reached the analog phase and were treated with a different antibacterial solution within a specific time frame. Then a drop count method was performed to capture any leftover bacteria. The viability of the bacteria is determined by the presence of the colonies in the dilute solution of bacteria. The concentration and the exposure time for each solution were captured. Failure to eliminate all the bacteria in any of the three replicates is considered to be not effective for that respective solution concentration and exposure time. Based on the data, most of the antiseptic solutions show their efficacy on treating the bacteria less than 2 minutes, except the chlorhexidine. As we can see, povidone iodine can treat the bacteria as fast as 15 seconds. In the conclusion, treating and preventing SSI and PGIs are challenging as number of bacteria may still resist after multiple attempts of removal. Results show that there's a significant effect on of the multiple common antiseptic antibacterial solution against the three common encounter resistant bacteria within 2 minutes. Different antibacterial solution have a different killing time point on different bacteria. The most effective antimicrobial microbial solution against all three organisms tested in this study is 0.35% of povidone iodine, following by 0.5% of the sodium hypochlorite and Bactocin. Data also indicate that combination of the effective antimicrobial with the application appropriate irrigation process for the specific time point will result in the most effective treatment methodology for treating surgical side effects. There are a couple of limitations in this study, including average drop count method, inconsistency in the experience perform techniques, and the time constraint, leaving the demand for the future study on a different antibacterial solution with a longer exposure time and different techniques other than the drop count method, which is limited and time consuming. So this is the end of my presentation. Hope you enjoy it and hope this actually give you more information, more interesting information. And I'm happy to be here to answer any question that you may have. Thank you.